Okay, let's just dive right into this. Welcome back to another explainer. Today, we're taking the absolute cutting edge of science and breaking it down so you can see exactly how the future is being built right now. And I gotta tell you, today's topic, it feels like something pulled straight out of a hyper-realistic sci-fi film. Like, think Unreal Engine 5 levels of futuristic. But I absolutely assure you, everything we're talking about today is completely grounded, manufacturable, and technologically real. It's all exactly as described in the foundational technical document for Projecto NeuroGlyQ. We are talking about an AI-guided, quantum precision neuromodulation platform. So this isn't just a new pill or a generic medical device. It is a fully integrated cyber-physical medical system. So think about this for a second. What if we could just turn off pain and anxiety, but with quantum precision? Usually, when we treat severe brain disorders, we basically flood the entire central nervous system with systemic drugs, right? We just cross our fingers, hoping they hit the right receptors, and we usually end up with a whole cascade of unwanted side effects. It's kind of like using a shotgun to try and hit a tiny bullseye. But the source document we're unpacking today outlines a method to literally switch off highly specific neural circuits with sub-millimeter precision. And the craziest part? No surgery. They're doing this using quantum mechanics and focused acoustics.
All right, really quickly, here is our system boot sequence for today's explainer. First, we'll cover the NeuroGlyQ project itself. Second, the quantum advantage. Third, metamaterials and ultrasound. Fourth, the smart digital brain. And finally, taking this tech from the lab straight to the patient.
Okay, section 1, the NeuroGlyQ Project and the overarching vision.
So the vision here is swapping out that pharmacological shotgun for a quantum sniper rifle. The inventor, Lázaro López Paz, actually worked alongside DeepSeek AI, acting as a conceptual co-inventor, which is fascinating, to design this platform. The goal is to deliver a highly specific inhibitory neurotransmitter exactly where it's needed, exactly when it's needed, and verify it in real time. We're looking at indications that represent millions of patients who have basically exhausted all traditional treatments: refractory generalized anxiety disorder, central neuropathic pain, drug-resistant focal epilepsy, severe chronic insomnia. These are brutal conditions where abnormal neurofiring literally ruins lives. NeuroGlyQ's objective is to silence that very specific abnormal activity without just sedating the entire brain. But to pull that off, they needed a very, very special payload.
Which brings us to section 2, the quantum advantage, specifically the quantum payload. Now, the payload they're using isn't some complex synthetic narcotic. Actually, it's an engineered version of something your body already uses to calm the nervous system down, the amino acid glycine. But they've given it a massive quantum upgrade. The core physics driving this whole innovation is called the kinetic isotope effect. So, in standard glycine, carbon-hydrogen bonds get broken down super fast by the body's enzymes. Imagine the enzymes are like overly aggressive bouncers just kicking the molecule right out of your system. But by substituting those specific hydrogen atoms with deuterium, which is just a heavier isotope of hydrogen, the inventors leverage a difference in zero-point energy. Because deuterium is heavier, it vibrates at a lower frequency. It sits deeper in its quantum energy well, which basically means your body's enzymes have to work so much harder to break that bond. It is an incredibly clever, direct use of quantum mechanics to hack pharmacology. And here is why that quantum hack absolutely matters. It creates a massive pharmacokinetic advantage. Standard glycine, it has a plasma half-life of about 30 to 45 minutes. It just disappears way too fast to be useful for this kind of localized, hyper-precise therapy. But the deuterated glycine, the D2-gly, that stretches the half-life all the way out to 2.5 to 3 hours. So you suddenly get this huge, stable therapeutic window. You have all the time you need to get the molecule exactly where you want it in the brain before it degrades. But how do you get it there without it just activating everywhere else along the way?
Enter the molecular Trojan horse, D2-gly-MB. It's a lipid microbubble, and it's filled with perfluorobutane gas. The deuterated glycine is actually tethered to the outside of this tiny bubble using a highly specific, mechanosensitive thioester bond. Just think of it like a microscopic padlock. The drug is locked in a totally inactive state, safely circulating through the patient's bloodstream, completely inert. It literally does nothing, until it receives the exact right physical key to snap that padlock open. So what's the key? That's section 3. Metamaterials and ultrasound or acoustic delivery. We need a way to reach deep inside the brain, completely non-invasively, with millimeter precision to snap those chemical locks. And the answer here is focused acoustics. But to be clear, they aren't using your standard run-of-the-mill medical ultrasound. No, they are utilizing acoustic metamaterial lenses. These lenses are designed by an AI inverse design algorithm and physically manufactured using advanced 3D printing on a microscopic scale. We are talking about a single 5-centimeter lens packing roughly 50,000 tiny resonators. These resonators manipulate sound waves so precisely that they actually bypass classical diffraction limits, focusing the acoustic energy into a tiny subdiffraction 2.5 millimeter point deep inside the brain tissue. 2.5 millimeters. That is incredibly precise. So let's walk through what this highly advanced yet entirely manufacturable procedure actually looks like for a real patient in a clinic. First, the patient puts on a specialized helmet packed with optically pumped magnetometers. These are hypersensitive quantum sensors that map brain activity in real time. Next, the patient gets a simple IV injection of those microbubbles carrying the locked glycine payload. Finally, the automated system uses that 3D printed metamaterial lens to fire a pulse of low-intensity focused ultrasound. The sound waves hit the microbubbles, the bubbles oscillate, the sheer mechanical force snaps that molecular padlock, and boom, the calming glycine is released instantly, but strictly within that tiny 2.5 millimeter target zone.
Section 4. The Smart Digital Brain. The AI conductor running the whole show. Because, let's be honest, the level of precision we are talking about here requires way more than just steady human hands. It requires a conductor that can calculate complex acoustics, brain matter density, and real-time neural feedback all simultaneously. The entire platform runs on a software as a medical device called the DeepSeek Clinical Cortex. And that number there, 10,000, that represents the number of MRI brain volumes used to train the specific AI. Before a single sound wave is ever fired, the AI basically acts as a highly advanced flight simulator for the human brain, modeling exactly how the ultrasound will travel through that specific patient's unique skull thickness, their vascularity, and their tissue. And there are 4 core modules that make this possible. First, it generates a digital twin, a full 3D simulation of the patient's brain. Second, automated planning optimizes the exact targeting. Third, and honestly this is mind-blowing, is the closed-loop control. As the procedure is happening, that quantum helmet is reading the patient's brainwaves. If the targeted anxiety or pain circuit hasn't fully quieted down yet, the AI reads that data in milliseconds and adjusts the ultrasound pressure on the fly until it gets the exact desired effect. And finally, it even acts as quality assurance. It uses hyperspectral cameras to visually inspect every single manufactured vial of the microbubbles before use. It's just total, flawless, end-to-end integration. Which brings us to our final stop, Section 5, Lab to Patient, the execution plan. Okay, I know we've talked about quantum chemistry, metamaterials, and AI. It can sound like a sci-fi dream, but the source document lays out an incredibly structured, grounded, real-world execution plan to actually get this tech to the patient. It's a meticulously planned timeline. In 2026, the foundational patents are filed, and Lopez Neurotech is incorporated. By 2028, they initiate Phase 0 clinical trials. By 2030, they're targeting the CE mark for the system in Europe, launching in 5 specialized hospitals. And by 2032, they project reaching 50 centers with a revenue target of 45 million euros. They have a totally clear, defined path to make this hyper-realistic tech an everyday clinical reality. But of course, to get to market, they have to prove it actually works through incredibly rigorous testing. They start with healthy volunteers for proof of concept. Then they scale up to neuropathic pain to ensure dosing safety. Phase 2B targets refractory anxiety to really prove efficacy. And finally, a massive Phase 3 trial across 15 European hospitals will tackle focal epilepsy for pivotal registration. This isn't just theory. This is standard, rigorous, undeniable medical science validating quantum neuromodulation step by step. And behind all of this scientific brilliance is a very smart corporate structure backing that 45 million euro projection. The inventor, Lázaro López Paz, retains a 51% controlling stake, with 49% allocated to strategic investors. And their business model is fascinating. They're employing a drug plus device as a service model. So hospitals don't just buy a massive machine once. They lease the ultrasound system, they license that DeepSeek AI annually, and they purchase the specific microbubble vials per procedure. It perfectly aligns ongoing clinical success with sustainable, scalable business growth. To wrap things up, I really want to leave you with this final, powerful quote directly from the document's deposit registry. This project was entirely devised by Lázaro López Paz in creative collaboration with DeepSeek AI, acting as conceptual co-inventor. We are literally entering an era right now where the lines between human ingenuity and artificial intelligence are dissolving to create hyper-advanced, entirely new paradigms in medicine. So the question you have to take away from all this is, as AI transitions from just being a simple tool to a recognized conceptual co-inventor, what previously incurable frontiers of the human body will we conquer next? Thanks for joining me on this explainer, and I will see you on the next deep dive.